Advance Directive. What is an advance directive? You have the right to have an advance directive. An advance directive is written instruction about your healthcare that is recognized under California law. It includes information that states how you would like healthcare provided or says what decisions you would like to be made if or when you are unable to speak for yourself. You may sometimes hear an advance directive described as a living will or durable power of attorney. California law defines an advance directive as either an oral or written individual healthcare instruction or a power of attorney, a written document giving someone permission to make decisions for you. All mental health plans are required to have advance directive policies. Your mental health plan is required to provide written information on the mental health plan's advance directive policies and an explanation of state law if asked for the information. If you would like to request the information, you should call your mental health plan for more information. An advance directive is designed to allow people to have control over their own treatment, especially when they are unable to provide instructions about their own care. It is a legal document that allows people to say, in advance, what their wishes would be if they become unable to make healthcare decisions. This may include such things as the rights to accept or refuse medical treatment, surgery, or make other healthcare choices. In California, an advance directive consists of two parts: your appointment of an agent, a person making decisions about your healthcare, and your individual healthcare instructions. You may get a form for an advance directive from your mental health plan or online. In California, you have the right to provide advance directive instructions to all of your healthcare providers. You also have the rights to change or cancel your advance directive at any time. If you have a question about California law regarding advance directive requirements, you may send a letter to California Department of Justice. Attention, Public Inquiry Unit, P.O. Box 944255, Sacramento, CA 94244-2550. Before you start your services, San Bernardino County Department of Behavioral Health will provide you with a copy of the Advanced Healthcare Directive information and a guide to your Medi-Cal benefits. The Advanced Healthcare Directive can be submitted anytime to your healthcare provider. Advanced Healthcare Directive information can be accessed at https://wp.sbcounty.gov/uploads/2021//05/C O M 028 dot PDF. Adverse benefit determinations by your mental health plan. What rights do I have if the mental health plan denies the services I want or think I need? If your mental health plan or a provider on behalf of the mental health plan denies, limits, reduces, delays, or ends services you want or believe you should get, you have the right to a written notice, called a Notice of Adverse Benefit Determination, from the mental health plan. You also have a right to disagree with the decision by asking for an appeal. The sections below discuss your rights to a notice and what to do if you disagree with your mental health plan's decision. What is an adverse benefit determination? An adverse benefit determination is defined to mean any of the following actions taken by a mental health plan. 1. The denial or limited authorization of a requested service, including determinations based on the type or level of service, medical necessity, appropriateness, setting or effectiveness of a covered benefit. 2. The reduction, suspension, or termination of a previously authorized service. 3. The denial, in whole or in part, of payment for a service. 4. The failure to provide services in a timely manner. 5. The failure to act within the required timeframes for standard resolution of grievances and appeals. If you file a grievance with the mental health plan and the mental health plan does not get back to you with a written decision on your grievance within 90 days. If you file an appeal with the mental health plan and the mental health plan does not get back to you with a written decision on your appeal within 30 days, or if you filed an expedited appeal and did not receive a response within 72 hours, or 6. The denial of a beneficiary's request to dispute financial liability. What is a notice of adverse benefit determination? A notice of adverse benefit determination is a written letter that your mental health plan will send you if it makes a decision to deny, limit, reduce, delay, or end services you and your provider believe you should get. This includes a denial of payment for a service, a denial based on claiming the services are not covered, a denial based on claiming the services are not medically necessary, a denial that the service is for the wrong delivery system, or a denial of a request to dispute financial liability. A notice of adverse benefit determination is also used to tell if your grievance, appeal, or expedited appeal was not resolved in time, or if you did not get services within the mental health plan's timeline standards for providing services. Timing of the notice. The mental health plan must mail the notice to the beneficiary at least 10 days before the date of action for termination, suspension, or reduction of a previously authorized specialty mental health service. The mental health plan must also mail the notice to the beneficiary within 2 business days of the decision for denial of payment or decisions resulting in denial, delay, or modification of all or part of the requested specialty mental health services. Will I always get a notice of adverse benefit determination when I don't get the services I want? When I don't get the services I want? Yes, you should receive a notice of adverse benefit determination. However, if you do not receive a notice, you may file an appeal with the county mental health plan, or if you have completed the appeal process, you can request a state fair hearing. When you make contact with your county, indicate you experienced an adverse benefit determination but did not receive notice. Information on how to file an appeal or request a state fair hearing is included in this handbook. Information should also be available in your provider's office. What will the notice of adverse benefit determination tell me? The notice of adverse benefit determination will tell you what your mental health plan did that affects you and your ability to get services, the date the decision will take effect, and the reason for the decision, the state or federal rules the decision was based on, your rights to an appeal if you do not agree with the mental health plan's decision, how to receive copies of the documents, records, and other information related to the mental health plan's decision, how to file an appeal with the mental health plan, how to request a state fair hearing if you are not satisfied with the mental health plan's decision on your appeal, how to request an expedited appeal or an expedited state fair hearing, how to get help filing an appeal or requesting a state fair hearing, how long you have to file an appeal or request a state fair hearing, your right to continue to receive services while you wait for an appeal or state fair hearing decision, how to request for continuation of these services, and whether the costs of these services will be covered by Medi-Cal. When you have to file your appeal or state fair hearing request if you want the services to continue. What should I do when I get a notice of adverse benefit determination? When you get a notice of adverse benefit determination, you should read all the information on the notice carefully. If you don't understand the notice, your mental health plan can help you. You may also ask another person to help you. You can request a continuation of the service that has been discontinued when you submit an appeal or request for a state fair hearing. You must request the continuation of services no later than 10 calendar days after the date the notice of adverse benefit determination was postmarked or personally given to you, or before the effective date of the change. For assistance with the Notice of Adverse Benefit Determination process and your options, please call the Access Unit at 1-888-743-1478. Beneficiary Rights and Responsibilities. What are my rights as a recipient of specialty mental health services? As a person eligible for Medi-Cal, you have a right to receive medically necessary specialty mental health services from the Mental Health Plan. When accessing these services, you have the right to be treated with personal respect and respect for your dignity and privacy. Receive information on available treatment choices and have them explained in a manner you can understand. Take part in decisions regarding your mental health care, including the right to refuse treatment. Be free from any form of restraint or seclusion used as a means of coercion, discipline, convenience, punishment, or retaliation about the use of restraints and seclusion. Ask for and get a copy of your medical records and request that they be changed or corrected if needed. Receive the information in this handbook about the services covered by the Mental Health Plan, other obligations of the Mental Health Plan, and your rights as described here. Receive specialty mental health services from a mental health plan that follows its contract with the state for the availability of services, assurances of adequate capacity and services, coordination and continuity of care, and coverage and authorization of services. The mental health plan is required to employ or have written contracts with enough providers to make sure that all Medi-Cal eligible beneficiaries who qualify for specialty mental health services can receive them in a timely manner. Cover medically necessary services out of network for you in a timely manner if the mental health plan does not have an employee or contract provider who can deliver the services. Out-of-network provider means a provider who is not on the mental health plan list of providers. In this case, the mental health plan must make sure you do not pay anything extra for seeing an out-of-network provider. Make sure providers are trained to deliver the specialty mental health services that the providers agree to cover. Make sure that the specialty mental health services the mental health plan covers are enough in amount, length of time, and scope to meet the needs of Medi-Cal eligible beneficiaries. This includes making sure the mental health plan system for approving payments for services is based on medical necessity and make sure the access criteria is fairly used. Make sure that its providers do adequate assessments of people who may receive services and that they work with people who will receive services to develop goals for the treatment and services that will be given. Provide a second opinion from a qualified healthcare professional within the mental health plan network or one outside the network at no additional cost to you if you request it. Coordinate the services it provides with services being provided to you through a Medi-Cal managed care plan or with your primary care provider if necessary, and make sure your privacy is protected as specified in federal rules on the privacy of health information. Provide timely access to care, including making services available 24 hours a day, 7 days a week, when medically necessary to treat an emergency psychiatric condition or an urgent care or crisis condition. Participate in the state's efforts to encourage the delivery of services in a culturally competent manner to all people, including those with limited English proficiency and varied cultural and ethnic backgrounds. Your mental health plan must make sure your treatment is not changed in a harmful way as a result of you expressing your rights. Your mental health plan is required to follow applicable federal and state laws, such as Title VI of the Civil Rights Act of 1964, as implemented by regulations at 45 CFR Part 80, the Age Discrimination Act of 1975, as implemented by regulations at 45 CFR Part 91, the Rehabilitation Act of 1973, Title IX of the Education Amendments of 1972 regarding education programs and activities, Titles II and III of the Americans with Disabilities Act, Section 1557 of the Patient Protection and Affordable Care Act, as well as the rights described here. You may have additional rights under state laws about mental health treatment. If you wish to contact your county's patients' rights advocate, you can do so by contacting Patients' Rights, 850E Foothill Boulevard, Rialto, CA 92376. Phone 1-800-440-2391. What are my responsibilities as a recipient of specialty mental health services? As a recipient of specialty mental health services, it is your responsibility to carefully read this beneficiary handbook and other important informing materials from the mental health plan. These materials will help you understand which services are available and how to get treatment if you need it. Attend your treatment as scheduled. You will have the best result if you work with your provider to develop goals for your treatment and follow those goals. If you do need to miss an appointment, call your provider at least 24 hours in advance and reschedule for another day and time. Always carry your Medi-Cal Benefits Identification Card, BIC, and a photo ID when you attend treatment. Let your provider know if you need an oral interpreter before your appointment. Tell your provider all your medical concerns. The more complete information that you share about your needs, the more successful your treatment will be. Make sure to ask your provider any questions that you have. It is very important you completely understand the information that you receive during treatment. Follow through on the planned action steps you and your provider have agreed upon. Contact the Mental Health Plan if you have any questions about your services or if you have any problems with your provider that you are unable to resolve. Tell your provider and the Mental Health Plan if you have any changes to your personal information. This includes your address, phone number, and any other medical information that may affect your ability to participate in treatment. Treat the staff who provide your treatment with respect and courtesy. If you suspect fraud or wrongdoing, report it. The Department of Healthcare Services asks that anyone suspecting Medi-Cal fraud, waste, or abuse to call the DHCS Medi-Cal Fraud Hotline at 1-800-822-6222. If you feel this is an emergency, please call 911 for immediate assistance. The call is free, and the caller may remain anonymous. You may also report suspected fraud or abuse by email to fraud@dhcs.ca.gov or use the online form at HTTP://www.dhcs.ca.gov/FRAUD.ASPX. San Bernardino County, Behavioral Health, Mental Health Plan, MHP, Beneficiary Handbook, Specialty Mental Health Services, Department of Behavioral Health, 303 E. Vanderbilt Way, San Bernardino, CA 92415. Revised date, December 1, 2023. Effective date, January 1, 2024. The handbook must be provided at the time the beneficiary first accesses services. Call your mental health plan toll-free at 1-888-743-1478, TTY 711, or visit online at http://wp.sbcounty.gov/DBH/. San Bernardino County Department of Behavioral Health is available 7 days a week, 24 hours a day. General information. Why is it important to read this handbook? Specialty Mental Health Services, SMHS, are available to all Medi-Cal beneficiaries throughout all regions of San Bernardino County. This handbook is available by request at your provider's office and available online. This handbook tells you how to get Medi-Cal specialty mental health services through your county mental health plan. This handbook explains your benefits and how to get care. It will also answer many of your questions. You will learn how to access specialty mental health services, what benefits you have access to, what to do if you have a question or problem, your rights and responsibilities as a Medi-Cal beneficiary. If you do not read this handbook now, you should keep this handbook so you can read it later. This handbook and other written materials are available either electronically at https://wp.sbcounty.gov/DBH/resources/ or in printed form from the mental health plan, free of charge. Call your mental health plan if you would like a printed copy. Use this handbook as an addition to the information you received when you enrolled in Medi-Cal. Need this handbook in your language or a different format? Need this handbook in your language or a different format? If you speak a language other than English, free oral interpreter services are available to you. Call San Bernardino County Department of Behavioral Health. Your mental health plan is available 24 hours a day, 7 days a week. You can also contact your mental health plan at 1-888-743-1478, TTY 711, if you would like this handbook or other written materials in alternative formats such as large print, braille, or audio. Your mental health plan will assist you. If you would like this handbook or other written materials in a language other than English, call your mental health plan. Your mental health plan will assist you in your language over the phone. This information is available in the languages listed below: English, Spanish, Mandarin, Vietnamese. What is my mental health plan responsible for? Your mental health plan is responsible for the following: figuring out if you meet the criteria to access specialty mental health services from the county or its provider network, providing an assessment to determine whether you need specialty mental health services, providing a toll-free number that is answered 24 hours a day, 7 days a week, that can tell you how to get services from the mental health plan. 1-888-743-1478, TTY 711. having enough providers close to you to make sure that you get the mental health treatment services covered by the mental health plan if you need them. Informing and educating you about services available from your mental health plan. Providing you services in your language or by an interpreter, if necessary, free of charge, and letting you know that these interpreter services are available. Providing you with written information about what is available to you in other languages or alternative forms, like Braille or large-size print. Upon request, written information can be provided in other languages and alternative formats, such as Braille and large font. Providing you with notice of any significant change in the information specified in this handbook at least 30 days before the intended effective date of the change. A change is considered significant when there is an increase or decrease in the amount or types of services that are available, or if there is an increase or decrease in the number of network providers, or if there is any other change that would impact the benefits you receive through the mental health plan. Coordinate your care with other plans or delivery systems as needed to facilitate care transitions and guide referrals for beneficiaries, ensuring that the referral loop is closed and the new provider accepts the care of the beneficiary. Ensuring you have continued access to your previous and current out-of-network provider for a period of time if changing providers would cause your health to suffer or increase your risk of hospitalization. Important information about the Medi-Cal program. Is transportation available? If you have trouble getting to your Medi-Cal appointments or mental health plan appointments, the Medi-Cal program can help you find transportation. Transportation may be provided for Medi-Cal beneficiaries who are unable to provide transportation on their own and who have a medical necessity to receive Medi-Cal covered services. There are two types of transportation for appointments. Non-medical transportation is transportation by private or public vehicle for people who do not have another way to get to their appointment. Non-emergency medical transportation is transportation by ambulance, wheelchair van, or litter van for those who cannot use public or private transportation. Transportation is available for trips to the pharmacy or to pick up needed medical supplies, prosthetics, orthotics, and other equipment. For more information and assistance regarding transportation, contact your managed care plan. If you have Medi-Cal but are not enrolled in a managed care plan and you need non-medical transportation to a health-related service, you can contact the non-medical transportation provider directly or your provider for assistance. When you contact the transportation company, they will ask for information about your appointment date and time. If you need non-emergency medical transportation, your provider can prescribe non-emergency medical transportation and put you in touch with a transportation provider to coordinate your ride to and from your appointments. If you or your family member are eligible for Medi-Cal, you can call your managed care plan for additional transportation information. Inland Empire Health Plan, IEHP. Effective March 1, 2020, transportation for routine medical visits including behavioral health and substance use must be scheduled 5 business days before your appointment. To set up transportation, please call IEHP Transportation Department at 1-800-440-IEHP 4347, option 2. TTY users should call 1-800-718-IEHP 4347, option 2. Available Monday through Friday, 8 a.m. to 5 p.m. For bus passes, please call Transportation Vendor, Call the Car, CTC, at 1-855-673-3195, option 1. Once you get your bus pass, you can use this for all your healthcare visits. To learn more about IEHP's benefits and services, read Chapter 4 of the IEHP Medi-Cal Member Handbook or call IEHP Member Services at 1-800-440-IEHP 4347. TTY users should call 1-800-718-IEHP 4347. Available Monday through Friday, 7 a.m. to 7 p.m., and Saturday through Sunday, 8 a.m. to 5 p.m. Molina, for emergency medical transportation. Emergency transportation, ambulance, or ambulance transport services provided through the 911 emergency response system will be covered when medically necessary. If you need emergency medical transportation, please call 911. For non-emergency medical transportation and non-medical transportation, please call American Logistics at 1-844-292-2688. American Logistics accepts requests 24 hours a day, 7 days a week. It is recommended calling at least 3 business days in advance of your appointment, or call as soon as you can when you have an urgent appointment. To learn more about Molina's benefits and services, call Molina Medi-Cal Member Services at 1-888-665-4621. TDD TTY 711. Available Monday through Friday, 7 a.m. to 7 p.m. local time. What are emergency services? Emergency services are services for beneficiaries experiencing an unexpected medical condition, including a psychiatric emergency medical condition. An emergency medical condition has symptoms so severe, possibly including severe pain, that an average person could reasonably expect the following might happen at any moment. The health of the individual or the health of an unborn child could be in serious trouble. Causes serious harm to the way your body works. Causes serious damage to any body organ or part. A psychiatric emergency medical condition occurs when an average person thinks that someone is a current danger to himself or herself or another person because of a mental health condition or suspected mental health condition, is immediately unable to provide or eat food, or use clothing or shelter because of a mental health condition or suspected mental health condition. Emergency services are covered 24 hours a day, 7 days a week for Medi-Cal beneficiaries. Prior authorization is not required for emergency services. The Medi-Cal program will cover emergency conditions, whether the condition is due to a physical health or mental health condition. Thoughts, feelings, behaviors which are a source of distress and/or dysfunction in relation to oneself or others. If you are enrolled in Medi-Cal, you will not receive a bill to pay for going to the emergency room, even if it turns out to not be an emergency. If you think you are having an emergency, call 911 or go to any hospital or other setting for help. Do I have to pay for Medi-Cal? Most people do not have to pay anything for Medi-Cal. In some cases, you may have to pay for Medi-Cal, depending on the amount of money you get or earn each month. If your income is less than Medi-Cal limits for your family size, you will not have to pay for Medi-Cal services. If your income is more than the Medi-Cal limits for your family size, you will have to pay some money for your medical or substance use disorder treatment services. The amount that you pay is called your share of cost. Once you have paid for your share of cost, Medi-Cal will pay the rest of your covered medical bills for that month. In the months that you don't have medical expenses, you don't have to pay anything. You may have to pay a copayment for any treatment under Medi-Cal. This means you pay an out-of-pocket amount each time you get a medical service or go to a hospital emergency room for your regular services. Your provider will tell you if you need to make a copayment. Who do I contact if I'm having suicidal thoughts? If you or someone you know is in crisis, please call the National Suicide Prevention Lifeline at 988 or 1-800-273-TALK 8255. Chat is available at https://988lifeline.org/. Local individuals seeking assistance in a crisis may contact San Bernardino County Department of Behavioral Health Crisis Contact Line at 1-800-398-0018 via phone or 1-909-420-0560 via text message. Available 7 days a week, 24 hours a day. The Crisis Contact Center provides telephone, telehealth, and text messaging crisis support services to individuals in any city throughout the county and, when appropriate, coordinates 24/7 in-person mobile crisis response to many cities throughout the county. Where can I go for more information about Medi-Cal? Visit the Department of Healthcare Services website at https://medicalis.aspx for more information about Medi-Cal. Language taglines. English tagline. Attention! If you need help in your language, call 1-888-743-1478, TTY 711. Aids and services for people with disabilities, like documents in Braille and large print, are also available. Call 1-888-743-1478, TTY 711. These services are free of charge. Non-discrimination notice. Discrimination is against the law. San Bernardino County Department of Behavioral Health follows state and federal civil rights laws. San Bernardino County Department of Behavioral Health does not unlawfully discriminate, exclude people, or treat them differently because of sex, race, color, religion, ancestry, national origin, ethnic group identification, age, mental disability, physical disability, medical condition, genetic information, marital status, gender, gender identity, or sexual orientation. San Bernardino County Department of Behavioral Health provides free aids and services to people with disabilities to help them communicate better, such as qualified sign language interpreters, written information in other formats, large print, Braille, audio, or accessible electronic formats. Free language services to people whose primary language is not English, such as qualified interpreters. Information written in other languages. If you need these services, contact San Bernardino County Department of Behavioral Health 24 hours a day, 7 days a week by calling 1-888-743-1478, or if you cannot hear or speak well, please call TTY 711. Upon request, this document can be made available to you in Braille, large print, audio, or accessible electronic formats. How to file a grievance. If you believe that San Bernardino County Department of Behavioral Health has failed to provide these services, or unlawfully discriminated in another way on the basis of sex, race, color, religion, ancestry, national origin, ethnic group identification, age, mental disability, physical disability, medical condition, genetic information, marital status, gender, gender identity, or sexual orientation, you can file a grievance with ACA 1557 Civil Rights Coordinator. You can file a grievance by phone, in writing, in person, or electronically. By phone, contact the ACA 1557 Compliance Coordinator between 7:30 a.m. to 5 p.m. by calling 1-909-252-5150. Or, if you cannot hear or speak well, please call TTY 711. In writing, fill out a complaint form or write a letter and send it to DBH, Office of Equity and Inclusion. Attention, ACA 1557 Compliance Coordinator, 303 E. Vanderbilt Way, San Bernardino, CA 92415. Email ACA_1557 at dbh.sbcounty.gov. In person, visit your doctor's office or San Bernardino County Department of Behavioral Health and say you want to file a grievance. Electronically, visit San Bernardino County Department of Behavioral Health's website at https://wp.sbcounty.gov/dbh/consumer forms/ Office of Civil Rights, California Department of Healthcare Services. You can also file a civil rights complaint with the California Department of Healthcare Services, Office of Civil Rights, by phone, in writing, or electronically. By phone, call 916-440-7370. If you cannot speak or hear well, please call 711 California State Relay. In writing, fill out a complaint form or send a letter to Department of Healthcare Services, Office of Civil Rights, P.O. Box 997413, MS 0009, Sacramento, CA 95899-7413. Complaint forms are available at https://www.dhcs.ca.gov/discrimination-grievance-procedures. Electronically, send an email to civilrights@dhcs.ca.gov. Office of Civil Rights, U.S. Department of Health and Human Services. If you believe you have been discriminated against on the basis of race, color, national origin, age, disability, or sex, you can also file a civil rights complaint with the U.S. Department of Health and Human Services, Office for Civil Rights, by phone, in writing, or electronically. By phone, call 1-800-368-1019. If you cannot speak or hear well, please call TTY TDD 1-800-537-7697. In writing, fill out a complaint form or send a letter to U.S. Department of Health and Human Services, 200 Independence Avenue, SW, Room 509F, HHH Building, Washington, D.C. 20201. Complaint forms are available at http://www.hhs.gov/office/index.html. Electronically, visit the Office for Civil Rights Complaint Portal at https://ocr.hhs.gov/portal/portal/lobby.jsf. Other languages and formats. Other languages. You can get this beneficiary handbook and other plan materials in other languages at no cost to you. We provide written translations from qualified translators. Call 1-888-743-1478, TTY 711. The call is toll-free. Read this beneficiary handbook to learn more about healthcare language assistance services, such as interpreter and translation services. Other formats. You can get this information in other formats, such as Braille, 20-point font large print, audio, and accessible electronic formats at no cost to you. Call 1-888-743-1478, TTY 711. The call is toll-free. Interpreter services. San Bernardino County Department of Behavioral Health provides oral interpretation services from a qualified interpreter on a 24-hour basis at no cost to you. You do not have to use a family member or friend as an interpreter. We discourage the use of minors as interpreters unless it is an emergency. Interpreter, linguistic, and cultural services are available at no cost to you. Help is available 24 hours a day, 7 days a week. For language help or to get this handbook in a different language, call 1-888-743-1478, TTY 711. The call is toll-free. Selecting a provider. How do I find a provider for the specialty mental health services I need? Your mental health plan is required to post a current provider directory online. If you have questions about current providers or would like an updated provider directory, visit your mental health plan website, wp.sbcounty.gov/dbh/resources/ or call the Mental Health Plan's toll-free number 1-888-743-1478, TTY 711. You can get a list in writing or by mail if you ask for one. The Mental Health Plan may put some limits on your choice of providers. When you first start receiving specialty mental health services, you can request that your mental health plan provide you with an initial choice of at least 2 providers. Your mental health plan must also allow you to change providers. If you ask to change providers, the mental health plan must allow you to choose between at least 2 providers to the extent possible. Your mental health plan is responsible to ensure that you have timely access to care and that there are enough providers close to you to make sure that you get the mental health treatment services covered by the mental health plan if you need them. Sometimes, mental health plans' contracted providers choose to no longer provide specialty mental health services. Providers of the mental health plan may no longer contract with the mental health plan or no longer accept Medi-Cal specialty mental health services patients on their own or at the request of the mental health plan. When this happens, the mental health plan must make an effort to give written notice to each person who was receiving specialty mental health services from the provider. The notice to the beneficiary shall be provided 30 calendar days prior to the effective date of the termination, or 15 calendar days after the mental health plan knows the provider will stop working. When this happens, your mental health plan must allow you to continue receiving services from the provider who left the mental health plan if you and the provider agree. This is called continuity of care and is explained below. Can I continue to receive services from my current provider? If you are already receiving specialty mental health services from another mental health plan, managed care plan, or an individual Medi-Cal provider, you may request continuity of care so that you can stay with your current provider for up to 12 months. You may wish to request continuity of care if you need to stay with your current provider to continue your ongoing treatment, or because it would cause serious harm to your mental health condition to change to a new provider. Your continuity of care request may be granted if the following is true. You have an ongoing relationship with the provider you are requesting and have seen that provider in the last 12 months. The provider is qualified and meets Medi-Cal requirements. The provider agrees to the mental health plan's requirement for contracting with the mental health plan and payment for services. And the provider shares relevant documentation with the mental health plan regarding your need for the services. Table of Contents. Other languages and formats. 6. Non-discrimination notice. 7. General information. 10. Important information about the Medi-Cal program. 13. How to tell if you or someone you know needs help. 18. Accessing specialty mental health services. 21. Selecting a provider. 29. Your right to access medical records and provider directory information using. 31. Scope of services. 32. Adverse benefit determinations by your mental health plan. 41. The problem resolution process to file a grievance or appeal. 45. The grievance process. 47. The appeal process, standard and expedited. 50. The state fair hearing process. 55. Advance directive. 58. Beneficiary rights and responsibilities. 60. The appeal process, standard and expedited. Your mental health plan must allow you to challenge a decision by your mental health plan that you do not agree with and request a review of certain decisions made by the mental health plan or your providers about your specialty mental health services. There are 2 ways you can request a review. One way is using the standard appeal process. The other way is by using the expedited appeal process. These 2 types of appeals are similar. However, there are specific requirements to qualify for an expedited appeal. The specific requirements are explained below. What is a standard appeal? A standard appeal is a request for review of a decision made by the mental health plan or your provider that involves a denial or changes to services you think you need. If you request a standard appeal, the mental health plan may take up to 30 days to review it. If you think waiting 30 days will put your health at risk, you should ask for an expedited appeal. The standard appeal process will allow you to file an appeal orally or in writing. Ensure filing an appeal will not count against you or your provider in any way. Allow you to authorize another person to act on your behalf, including a provider. If you authorize another person to act on your behalf, the mental health plan might ask you to sign a form authorizing the mental health plan to release information to that person. Have your benefits continued upon request for an appeal within the required time frame. which is 10 days from the date your notice of adverse benefit determination was mailed or personally given to you. You do not have to pay for continued services while the appeal is pending. However, if you do request continuation of the benefit and the final decision of the appeal confirms the decision to reduce or discontinue the service you are receiving, you may be required to pay the cost of services provided while the appeal was pending. Ensure that the individuals making the decision on your appeal are qualified to do so and not involved in any previous level of review or decision-making. Allow you or your representative to examine your case file, including your medical record and any other documents or records considered during the appeal process. Allow you to have a reasonable opportunity to present evidence and testimony and make legal and factual arguments in person or in writing. Allow you, your representative, or the legal representative of a deceased beneficiary's estate to be included as parties to the appeal. Let you know your appeal is being reviewed by sending you written confirmation. Inform you of your rights to request a state fair hearing following the completion of the appeal process with the mental health plan. When can I file an appeal? You can file an appeal with your mental health plan in any of the following situations. The mental health plan or one of the contracted providers decides that you do not qualify to receive any Medi-Cal specialty mental health services because you do not meet the access criteria. Your provider thinks you need a specialty mental health service and asks the mental health plan for approval, but the mental health plan does not agree and denies your provider's request or changes the type or frequency of service. Your provider has asked the mental health plan for approval, but the mental health plan needs more information to make a decision and doesn't complete the approval process on time. Your mental health plan does not provide services to you based on the timelines the mental health plan has set up. You don't think the mental health plan is providing services soon enough to meet your needs. Your grievance, appeal, or expedited appeal wasn't resolved in time. You and your provider do not agree on the specialty mental health services you need. How can I file an appeal? You may call your mental health plan to get help filing an appeal. The mental health plan will provide self-addressed envelopes at all provider sites for you to mail in your appeal. If you do not have a self-addressed envelope, you may mail your appeal directly to the address in the front of this handbook, or you may submit your appeal by fax to 1-909-501-0833. How do I know if my appeal has been decided? Your mental health plan will notify you or your representative in writing about their decision for your appeal. The notification will have the following information: the results of the appeal resolution process, the date the appeal decision was made. If the appeal is not resolved completely in your favor, the notice will also contain information regarding your right to a state fair hearing and the procedure for filing a state fair hearing. Is there a deadline to file an appeal? You must file an appeal within 60 days of the date on the notice of adverse benefit determination. There are no deadlines for filing an appeal when you do not get a notice of adverse benefit determination, so you may file this type of appeal at any time. When will a decision be made about my appeal? The mental health plan must decide on your appeal within 30 calendar days from when the mental health plan receives your request for the appeal. The timeframes for making a decision may be extended up to 14 calendar days if you request an extension, or if the mental health plan believes that there is a need for additional information and that the delay is for your benefit. An example of when a delay is for your benefit is when the mental health plan believes it might be able to approve your appeal if it has more time to get information from you or your provider. What if I can't wait 30 days for my appeal decision? The appeal process may be faster if it qualifies for the expedited appeal process. What is an expedited appeal? An expedited appeal is a faster way to decide on an appeal. The expedited appeal process follows a similar process to the standard appeal process. However, you must show that waiting for a standard appeal could make your mental health condition worse. The expedited appeal process also follows different deadlines than the standard appeal. The mental health plan has 72 hours to review expedited appeals. You can make a verbal request for an expedited appeal. You do not have to put your expedited appeal request in writing. When can I file an expedited appeal? If you think that waiting up to 30 days for a standard appeal decision will jeopardize your life, health, or ability to attain, maintain, or regain maximum function, you may request an expedited resolution of an appeal. If the mental health plan agrees that your appeal meets the requirements for an expedited appeal, your mental health plan will resolve your expedited appeal within 72 hours after the mental health plan receives the appeal. The timeframes for making a decision may be extended up to 14 calendar days if you request an extension, or if the mental health plan shows that there is a need for additional information and that the delay is in your interest. If your mental health plan extends the timeframes, the mental health plan will give you a written explanation as to why the timeframes were extended. If the mental health plan decides that your appeal does not qualify for an expedited appeal, the mental health plan must make reasonable efforts to give you prompt oral notice and will notify you in writing within 2 calendar days, giving you the reason for the decision. Your appeal will then follow the standard appeal timeframes outlined earlier in this section. If you disagree with the mental health plan decision that your appeal does not meet the expedited appeal criteria, you may file a grievance. Once your mental health plan resolves your request for an expedited appeal, the mental health plan will notify you and all affected parties orally and in writing. The grievance process. What is a grievance? A grievance is an expression of dissatisfaction about anything regarding your specialty mental health services that are not one of the problems covered by the appeal and state fair hearing processes. What is the grievance process? The grievance process will involve simple and easily understood procedures that allow you to present your grievance orally or in writing, not count against you or your provider in any way, allow you to authorize another person to act on your behalf, including a provider or advocate. If you authorize another person to act on your behalf, the mental health plan might ask you to sign a form authorizing the mental health plan to release information to that person. Ensure that the individuals making the decision are qualified to do so and not involved in any previous levels of review or decision-making. Identify the roles and responsibilities of you, your mental health plan, and your provider. Provide resolution for the grievance in the required timeframes. When can I file a grievance? You can file a grievance anytime with the mental health plan if you are unhappy with the specialty mental health services or have another concern regarding the mental health plan. How can I file a grievance? You may call your mental health plan to get help with a grievance. Grievances can be filed orally or in writing. Oral grievances do not have to be followed up in writing. If you want to file your grievance in writing, the mental health plan will provide self-addressed envelopes at all provider sites for you to mail in your grievance. If you do not have a self-addressed envelope, you may mail your grievance directly to the address that is provided on the front of this handbook. How do I know if the mental health plan received my grievance? Your mental health plan is required to let you know that it received your grievance by sending you a written confirmation within 5 calendar days of receipt. A grievance received over the phone or in person that you agree is resolved by the end of the next business day is exempt and you may not get a letter. When will my grievance be decided? The mental health plan must make a decision about your grievance within 90 calendar days from the date you filed your grievance. The timeframes for making a decision may be extended by up to 14 calendar days if you request an extension, or if the mental health plan believes that there is a need for additional information and that the delay is in your benefit. An example of when a delay might be for your benefit is when the mental health plan believes it might be able to resolve your grievance if they have more time to get information from you or other people involved. How do I know if the mental health plan has made a decision about my grievance? When a decision has been made regarding your grievance, the mental health plan will notify you or your representative in writing of the decision. If your mental health plan fails to notify you or any affected parties of the grievance decision on time, then the mental health plan is required to provide you with a notice of adverse benefit determination, advising you of your right to request a state fair hearing. Your mental health plan is required to provide you with a notice of adverse benefit determination on the date the timeframe expires. You may call the mental health plan for more information if you do not receive a notice of adverse benefit determination. Is there a deadline to file a grievance? No, you may file a grievance at any time. The problem resolution process. How to file a grievance or appeal. What if I don't get the services I want from my mental health plan? Your mental health plan must have a process for you to work out a complaint or problem about any issue related to the specialty mental health services you want or are receiving. This is called the problem resolution process, and it could involve 1. The grievance process. An expression of unhappiness about anything regarding your specialty mental health services or the mental health plan. 2. The appeal process. The review of a decision, e.g., denial, termination, or reduction to services that was made about your specialty mental health services by the mental health plan or your provider. 3. The state fair hearing process. The process to request an administrative hearing before a state administrative law judge if the mental health plan denies your appeal. Filing a grievance, appeal, or requesting a state fair hearing will not count against you and will not impact the services you are receiving. Filing a grievance or appeal helps to get you the services you need and to solve any problems you have with your specialty mental health services. Grievances and appeals also help the mental health plan by giving them the information they can use to improve services. When your grievance or appeal is complete, your mental health plan will notify you and others involved, such as providers, of the final outcome. When your state fair hearing is decided, the State Fair Hearing Office will notify you and others involved of the final outcome. You can learn more about each problem resolution process below. Can I get help with filing an appeal, grievance, or state fair hearing? Your mental health plan will help explain these processes to you and must help you file a grievance, an appeal, or to request a state fair hearing. The mental health plan can also help you decide if you qualify for what's called an expedited appeal process, which means it will be reviewed more quickly because your health, mental health, and/or stability are at risk. You may also authorize another person to act on your behalf, including your specialty mental health provider or advocate. If you would like help, call 1-888-743-1478, TTY 711. Your mental health plan must give you reasonable assistance in completing forms and other procedural steps related to a grievance or appeal. This includes, but is not limited to, providing interpreter services and toll-free numbers with TYY, TDD, and interpreter capability. Can the state help me with my problem/questions? You may contact the Department of Healthcare Services, Office of the Ombudsman, Monday through Friday, 8 a.m. to 5 p.m., excluding holidays, by phone at 888-452-8609, or by email at capital M, capital M, capital C, capital D, capital O, M, B, U, D, S, M, A, N, capital O, F, F, I, C, E, at dhcs.ca.gov. Please note, email messages are not considered confidential. You should not include personal information in an email message. You may also get free legal help at your local legal aid office or other groups. You can also contact the California Department of Social Services, CDSS, to ask about your hearing rights by contacting their Public Inquiry and Response Unit by phone at 800-952-5253. For TTY, call 800-952-8349. The State Fair Hearing Process. What is a state fair hearing? A state fair hearing is an independent review conducted by an administrative law judge who works for the California Department of Social Services to ensure you receive the specialty mental health services to which you are entitled under the Medi-Cal program. You may also visit the California Department of Social Services at https://www.cdss.ca.gov/hearing-requests for additional resources. What are my state fair hearing rights? You have the right to have a hearing before an administrative law judge, also called a state hearing. Be told about how to ask for a state fair hearing. Be told about the rules that govern representation at the state fair hearing. Have your benefits continued upon your request during the state fair hearing process if you ask for a state fair hearing within the required timeframes. When can I file for a state fair hearing? You can file for a state fair hearing in any of the following situations. You filed an appeal and received an appeal resolution letter telling you that your mental health plan denies your appeal request. Your grievance, appeal, or expedited appeal wasn't resolved in time. How do I request a state fair hearing? You can request a state fair hearing online at https://acms.dss.ca.gov/login.request.do. In writing. Submit your request to the County Welfare Department at the address shown on the Notice of Adverse Benefit Determination, or mail it to California Department of Social Services, State Hearings Division, P.O. Box 944243, Mail Station 9-17-37, Sacramento, CA 94244-2430, or by fax to 916-651-5210 or 916-651-2789. You can also request a state fair hearing or an expedited state fair hearing by phone. Call the State Hearings Division toll-free at 800-743-8525 or 855-795-0634, or call the Public Inquiry and Response Line toll-free at 800-952-5253 or TDD at 800-952-8349. Is there a deadline to ask for a state fair hearing? Yes, you only have 120 days to ask for a state fair hearing. The 120 days start from the date of the mental health plan's written appeal decision notice. If you didn't receive a notice of adverse benefit determination, you may file for a state fair hearing at any time. Can I continue services while I'm waiting for a state fair hearing decision? If you are currently receiving authorized services and you want to continue receiving the services while you wait for the state fair hearing decision, you must ask for a state fair hearing within 10 days from the date of receiving the notice of adverse benefit determination or before the date your mental health plan says services will be stopped or reduced. When you ask for a state fair hearing, you must say that you want to keep getting services during the state fair hearing process. If you do request continuation of services and the final decision of the state fair hearing confirms the decision to reduce or discontinue the service you are receiving, you may be required to pay the cost of services provided while the state fair hearing was pending. When will a decision be made about my state fair hearing decision? After you ask for a state fair hearing, it could take up to 90 days to decide your case and send you an answer. Can I get a state fair hearing more quickly? If you think waiting that long will be harmful to your health, you might be able to get an answer within 3 working days. Ask your general practitioner or mental health professional to write a letter for you. You can also write a letter yourself. The letter must explain in detail how waiting for up to 90 days for your case to be decided will seriously harm your life, your health, or your ability to attain, maintain, or regain maximum function. Then, make sure you ask for an expedited hearing and provide the letter with your request for a hearing. The Department of Social Services State Hearings Division will review your request for an expedited state fair hearing and decide if it qualifies. If your expedited hearing request is approved, a hearing will be held, and a hearing decision will be issued within 3 working days of the date your request is received by the State Hearings Division. Your rights to access medical records and provided directory information using. Your county is required to create and maintain a secure system so that you can access your medical records and locate a provider using common technologies such as a computer, smart tablet, or mobile device. This system is called a Patient Access Application Programming Interface, API. Information to consider in selecting an application to access your medical records and locate a provider can be found on your county's website. San Bernardino County Department of Behavioral Health is in the process of developing its API. In the meantime, you may access your medical records from the San Bernardino County Department of Behavioral Health Medical Records Unit by phone at 1-909-421-9350 or by email at dbh-medicalrecords@dbh.sbcounty.gov.